Most women have heard midlife horror stories of relentless anxiety, debilitating hot flashes, severe brain fog, and overall difficulty maintaining a normal life. If so, don't despair, because the integrative precision medicine model now offers incredible solutions. We're going to show you a real-life story of Annette, who really hit a wall. But fortunately, she got the care she needed to really have a vibrant life again.
I'm Annette Lennon, and I'm 65 years old. About 15 or so years, I started having hormonal issues. Dizziness, nervousness, hot flashes. I was like jittery.
This poor lady was losing her ability to function in the world. She was distraught, couldn't sleep through the night, and had terrible brain fog. And she was increasingly anxious.
Oh my God, always anxious.
She relayed to me that all of this seemed to come out of the blue after going through menopause, and it just kept getting worse and worse.
I was driving and I had a panic attack. I said, something is terribly wrong. She said, girl, what the heck are you doing in here? I just saw you. I said, Carolyn, you don't know. When I left your office, I couldn't drive anymore. I started having a panic attack.
My mind keeps searching, but my heart decides. Thoughts can be cruel, they're not mine to own.
This harrowing moment in her OBGYN's office marked a turning point for Annette. Her doctor knew she needed something more, and fortunately for her, made the referral to see Dr. Bazzan.
So I said, okay, can he see me emergency? She said to me, how far do you live from here? She said, if you can be, he has a cancellation and he has to be out of here at 3 o'clock. So if you can be here in 25 minutes, I said, girl, don't worry, I will be there. I called a cab. I got there and guess who was walking out of his office? Dr. Bazzan. I said, here I am. I didn't even know who he was, but I Googled him while I was in the car to see what he looks like and all. And he said, okay, come on in. And he take off his jacket, put back on his white coat.
So he was about to walk out because you got out,
yes.
You got there late.
I got it because I just meet him right in time.
I'm like, wow.
So anyway.
I love this story.
But anyway, it's so funny, Dr. Khan. It was too funny. He stayed with me for 2 hours. We spoke for 2 hours. And he said, I can't believe you're working because everything was totally off.
So it was much more than just a hormonal imbalance.
Yeah, balance. It was, oh my God.
So when Annette came in, the number one was overweight, obesity.
I used to be much heavier.
That already placed her into a overdrive over physiology. So blood sugar was high, she was inflamed.
I was so happy to have met him. He said, Annette, I can help you. You have to want to help yourself too. And he said to me, just like this, don't waste my time, because time is important. Don't waste your money. Money is too hard to come by. And that was the day, that time, I know Dr. Bazzan was right on cue.
Beyond the metabolic issues, a surprising revelation in Dr. Bazzan's advanced hormone testing uncovered that Annette's struggle was partly attributed to an unexpected factor, a deficiency in testosterone.
Interestingly, testosterone is very important for women because they don't have it. They don't have enough. And testosterone, when people think about testosterone, they think about a beard and acne. But in reality, what testosterone is a building hormone. When women get into that part of life, they go from anabolic, building the body, to catabolic, losing the body. The body is unable to keep itself on planet Earth anymore.
Because of the loss of these
Of the hormones, exactly. So you see now, this is how osteoporosis happens. This is how sarcopenia happens, meaning the loss of muscle mass, which is the signature sign of menopause. It happens to us too, but because we have such an amazing amount of hormone, we have 20 times more testosterone than they do, and they have 20 times more estrogen than we do. This is why we have a male body and then they have a female body. So, but if you look at the male for sarcopenia, loss of muscle, and osteoporosis, loss of bone density, the male is 20 years later on the average because this gigantic amount of testosterone that we're born with and we have for all of our lives. So even a tiny little bit of testosterone for women makes a gigantic difference. Also, one of the beauties of testosterone is anti-inflammatory.
The precision medicine approach that looks at these things like genetics, genomics, metabolomics is at the core of what people refer to as longevity medicine and anti-aging medicine. Hearing those terms, some people might be thinking we're heading into a Westworld-type robotic technology.
So complicated.
It's nothing like that. What we're really into with longevity medicine is blending the latest science of precision medicine with natural, integrative health methods that keep the body and brain functioning as youthful as possible. For example, many people have heard about the so-called blue zones, small pockets throughout the world where a staggering number of their residents live past 100 years. It's not just their age that's remarkable, but their health. Researchers are studying their lifestyle, diet, and social connections as important clues to their longevity. In longevity medicine, we take the learning lessons from Blue combined with the science of precision medicine to tailor the path forward.
He gave me a pill, I remember it, to take, and within 24 hours, I think it was a camera or something like that.
To make sure that your gut was okay.
Exactly right. So he told me what was going to happen. And exactly to the minute, that's what happened. Picked it up, put it in that little glass.
You had extensive blood work,
yes.
You had saliva
testing,
and then he also did a test to look at your
gut,
GI tract, your gut tract.
Exactly right.
The capsule endoscopy, genetic testing, and advanced hormonal analysis peeled back important layers of Annette's medical mystery. It soon became clear that there were multiple issues that had all come to a head. Hormone deficiency was part of the story, and while the potential benefits of bioidentical hormone replacement therapy were promising, another crucial factor lay in the health of her digestive system.
Gigantic is diet, especially after 50 years of age, makes the difference between life and death. And the diet is in the hands of the patient, not in the hands of the doctor. So if the patient doesn't get taught, doesn't understand, isn't brought to the point of understanding that when you look at what's on the table, you shouldn't be looking at what it tastes like. You should be looking at what it's going to do to you.
He said, you got to get rid of this. If I need a total cleanse. Like he was cleaning me out to make sure there's no chemical or nothing in my system. For, sometimes they make meat, probiotic and all that kind of stuff. So he gave me some to take in the morning. As soon as I wake up, I take them in the morning. Fish oil, NAC, because my head was all over the place. About a month afterwards, I lost 30 pounds.
An on-fire gut could significantly hamper the effectiveness of the hormonal treatment. Both issues were contributing to the symptoms of dysfunction. This revelation highlights the essence of precision medicine, a whole-person approach that addresses not just isolated symptoms, but the entire system.
Once we saw what needed to be done for the hormonal situation, we provided that.
By provided that, you gave her some bioidentical hormone replacement.
Exactly. Of course, being that she had very low levels, the replacement of those brought about a gigantic change.
Everything bioidentical. And I start feeling better and better.
And how are you sleeping now?
Oh my God, I can sleep from here till next week. I'm not kidding. My son said, Mommy, are you going to sleep your life away?
Remember, there's always hope and help available. If you've enjoyed this video, please give us a thumbs up. And don't forget to subscribe for more stories and health tips. Check out our other videos for more insights into precision medicine and integrative healthcare. I'm Dr. Dan Monti. Until next time, be well.